My name is Dr. Alrawi. I'm the chair of the Oncology and Surgery in one of the biggest tertiary referral centers in UAE. Centers in the world are important to get quality, people looking for centers. And the center doesn't buy a building alone, it is by people and the infrastructure of that center. We are here invest on bringing the top people from the world. I am from American boards from United States with a fellowship from Roswell Park Cancer Institute. We bring all American boarded, high qualified British boarded CCSD, plus high qualified European boarded. To bring them to this center, we invest on them, we invest on people, and then after we invest and bring them here, we invest on the center. In this case, we bring the best high quality of instrumentation, including like high quality MRI and PET scans and artificial intelligence and also robots to build the best quality. Centers in general is not by instrument. It's combination, instruments, people in the center, and by the leadership. I think from United Arab Emirates being here more than 7 years, I found it very intriguing that government of UAE spending and investing on all of these things, on the centers, on the people, and on the instruments, in order to get the best quality. Especially in Dubai, we are a tertiary referral center in Al Zahra. We have the medical tourism and we really attract all the patients coming from all over the world. So we need to define what is AI, because to the lay people, they don't understand what it is. Artificial intelligence is a new technology that's been implemented using high computer to define structural, anatomical, and directional guided to the physician. So let's give you an example, very simple. You have a mammogram, and radiology can give you 95% accuracy, especially in medium-sized and small-sized tumors. For the mammogram and the ultrasound, you mirror image it with the artificial intelligence picture, computer read it versus what is going to be the radiologist read it. This will give you accuracy of 99. So at this point, although we are in the infancy stage of artificial intelligence, we are a step ahead of localizing a tumor. We are still in UAE that our breast cancer cases coming with a big lump, but gradually we're going to a smaller and a smaller until we end into what we call it microcalcification or abnormality. Artificial intelligence doesn't work only reading, but also artificial intelligence will direct us where to localize our needle for the breast, what direction tell us, and also in the future, I'm sure we are working on a project of robotic artificial intelligence that the robot will do the job in order to get the best quality and the best care for the patient. So let's go back to the first step. How do we see AI, artificial intelligence now? It is still in the infancy stages, still in the premature phase of give a complete credit or discredit. But we found it's very helpful in building a reputation and trust. It is, first of all, it is a reinforcement education process. So when the radiologist miss one spot and the artificial intelligence computer tell him this is a spot, it's an educational for him to go on fish more before he asks the computer. So it is not embarrassing, it is a reinforcement education. Now, gradually, as we said, we are still here in UAE seeing big masses in the breast. I don't think so. I am as a surgeon, I can find this big mass palpable. I can see it in the ultrasound, I can see it in the mammogram, but the artificial intelligence real help will be in the smaller and even micro calcification. And the other part, gradually we are going to build what's needed for future in order to get our interventional radiology and our computer to help to build that process of getting either biopsy or advice to the patient, monitoring, plus shaping in surgery and reconstruction And we're just talking about the breast. Look whatever we have in other subspecialties of oncology and other subspecialties of medicine. My focus today is the oncology and surgery. You see, 20 years ago, radiologist has to be in the place to do readings. And he has to be 24 hours in the hospital in order to get that message. In the beginning of telemedicine, everybody is starting shying of it. In the beginning, they are missing. While now, 60% of the night shifts are done by telemedicine, either locally or internationally. I was in Jacksonville, Florida. Some private hospital read their radiology where there are people from Australia or from Middle East. Time difference and availability. And that transformation gives the same credit for artificial intelligence. Of course, some people will be antagonizing it in the beginning, but in reality, it will be transferred. But I don't think so it's going to be ready in this phase because we are still in the premature or infancy phase. But gradually, all computerized radiology should be second opinion by artificial intelligence. Let's start it with the second opinion. And this is artificial intelligence is going to tell me the same thing. It's not only radiology. Let's go back to the pathology also reading. Let's go back to other subspecialty. Now I use artificial intelligence in my laparoscopic gallbladder surgery. If difficult cases in laparoscopic gallbladder surgery, when I put in the computer that when we use a robot, it's immediately show me the gallbladder anatomy, cystic artery anatomy, cystic duct anatomy, and the common bile duct. That will be prevent any mischief that happen transection common bile duct. So in every spot in medicine, we can use artificial intelligence. The smart thing now, how we implement it and how we get advantage to go to next step. That is really a big word. AI will not replace physician. Like the same thing when I was in the 90s, when we bring the robot is going to replace the surgeons. The robot is going to replace the cardiologist for the. That's not. It's not. These are assisting doctors. It might be decrease his effort and his really struggling or ease his life by get a second opinion. As a replacement, I don't think so in now or in the near future or even in the far future. It is supplementary for any physician to get such high quality. We need to start with the mammogram, ultrasound, and then we go to the thyroid. I need the thyroid, which is my second goal, because we have a center of excellence of the breast, center of excellence of thyroid, and we are looking for sarcoma center of excellence. These things can give me immediate diagnosis. Can we get as nearby tissue diagnosis? We might consider it in the future by the HDU and which is the Hansfield unit of that tissue can give me an idea. This is what type of tumor and what is the possibility of to do the surgery for him. It is very important. It's a supplementary tool. It is give me more diagnosis, satisfied. Sometimes with the AA can give you immediate report. Patient will receive the report immediately without having any trouble. And in this case, you have to be careful. We need to justify the result that you give me from AI versus the radiologist. We need a second opinion for radiologist. We are in the phase 1 trial of AI in radiology. We cannot say we are ready for the second phase or third phase. Like any program or any research in the United States or in Europe, we have to go through phases. Since we are dealing with a human being, phases. So once we finish the first phase, we get good result, we go to second phase, we get the result, we get third phase, and then we get FDA approval for that medicine or that trial, or that we approved for to become an international. I think we are in the first phase, possibly going to the second phase. And then after that, we can make decision based on the people recommendation. Of course, the more your availability, the prices of phone came down. phone, when we are the first using the cellular phone, it was in thousands. Now it is in hundreds. And especially if we are going to machines that are rapidly catching, like the robot. The first robot, about $3 million. Now China, Japan are really developing these robots. It's going to be half price and going to be less and less and less.